I'm not Peter. Today we'll be looking at the female external genitalia, and which involve the labia majora, my moris bovis, minora, the vestibule, the clitoris, the greater vestibule, and the bulbus of the vestibule. Now, based on this diagram, the diagram I'm showing on my screen right now, this is the diagram of the female external genitalia. There is the moris. The moris is like a round patch of fat that lies anteriorly to the symphysis bovis, and the moris is covered with pubic hair from the time of puberty. And the next is the majora. Majora most times I call it my big lips. It's big lips, and it has a two-folded fat and at the area which is covered with the skin and the pubic area outside the outside outer surface. Okay, the outer surface is filled with the pubic area, and it has a pink smooth in the inside surface. Now sorry for the minora, which I call it the smallest, like like I use my mouth to explain the female genitalia, but I hope you have seen the diagram very well. um I just want to be explaining it bit by bit. This I call it like big lips. The minora is a small lip that is small, subcutaneous fold without fat, and they lies between the majora. And anteriorly, each of the minora is divided into parts which have the upper and the lower parts. The upper one is the one that passes through the clitoris. Are you seeing it? And which followed a fold, and the papyrus, which is like a skin. It is also found in the male too. It's just like the male skin or the main glands like that, and it is hung at the clitoris. The papyrus is a tracted piece of skin which is surrounded and protecting the clitoris. Now, the lower part is the one that passes below the clitoris that form the femoral of the clitoris. Now, let's just talk about the clitoris. Sometimes people say the clitoris look like the penis, but I call it a small rudimentary sense organ that corresponds to the male penis. And the vestibules notch like a portion located near to the anterior junction or the minora, above the opening of the ureter and the vagina. There's unlike the penis, the clitoris does not contain the distal portion of the ureter and functions solely to induce the orgasm during the sexual intercourse. Now, the vestibule is the area which is enclosed by the minora, and it has an opening of the ureter, and there's one found at the vaginal side. Now, the next we'll talk about is the ureter orifice. Closer to ureter orifice is where you see the the skinhead dots. The ureter orifice lies 2.5 posterior to the clitoris. Now, the distance from the ureter orifice to the clitoris is just 2.5 centimeter posteriorly. And immediately in front of it, you see the vaginal orifice. Now, on each side of the opening is where I talk about the skinhead dot. Skinhead dot is found on each side of the ureter, and there's small, and that thing have a small dot opening or tubes that open, just call it, and the centimeter is 0.5 centimeter long within the ureter wall. Now, the next we'll talk about is vaginal orifice. Vaginal orifice, we call it the introitus of the vagina, and it occupies the posterior wall, posterior to third of the vestibule. And when they say lady is a virgin, there's what they call hymen. And this hymen is like a tiny membrane that's here during sexual intercourse. And the remaining tag of the hymen is known as the calculi meiotic fluid, because they are thought to resemble the thylic berries. Now we have the last one, which is the greater vestibule, which is we know as the barotellar gland. These are two small glands that is found in either side of the vaginal orifice, and they lie posteriorly to the labia majora, and it secretes what we call the mucus, which is lubricated the vagina opening. Now, these ducts may occasionally become blocked, which can cause secretion from the gland to accumulate within the cystus. Now, blood supplies are mostly important in your cancer examination. Most times, they may ask you what is the blood supply to the external genitalia of the female of the female. Now, the blood supply is coming from the internal and external pudendary artery, and the blood drainage, which we're referring to the venous drainage, which is the corresponding vein. Now, the lymphatic drainage we talk about is the inguinal gland. The nerve supply is coming from the branches of the pulmonary nerve. Now, this end for this particular introduction of the external genitalia. If you have any question, please contact me on 081 48 82 4374. I'm needed nursing tutorial coach. I remain Nurse Peter Iku. God bless you for listening to this wonderful session.